Cancer Holistic Guidance, Part 50. Dr. Dilip Gadgil, Pune. The milk and ghee derived from an indigenous cow is the highest form of rasayan. The cells and tissues that it helps form are excellent in quality and there is no scope for the production of abnormal cells. When a patient is reliant on this kind of milk, assessing their digestive abilities becomes very important. The intake volume should be determined based on your unique digestive power. Initially, you might be able to digest only 500 or 700 milliliters. But drinking less is better than going overboard. It is recommended that you drink this milk only when you feel really hungry. And the most important thing to remember is that sticking to indigenous cow milk is imperative. Most patients and doctors are taken by surprise when I suggest drinking milk. They believe that milk is like poison and it shouldn't be consumed by cancer patients. However, they don't know about the difference between A1 and A2 milk. New Zealand-based Dr. Woodford wrote a book called Devil in the Milk on the subject. You can read it if you like. The hybrid or Jersey cow falls under the A1 category. It has been proved that the milk of this cow leads to diseases like cancer, autism, and diabetes, and the book talks about this challenge. This began in New Zealand when several children were diagnosed with juvenile diabetes. Fortunately, the Indian cow falls under the A2 category and is known to have the ability to cure cancer. It is considered extremely healthy and beneficial for cancer patients since it works like medicine. The Indian buffalo falls under the A2 category, too. Indigenous cow milk is said to have good rasayan properties and hence, I advise my patients to stick to this milk. In my experience, if a patient can digest 1.5 or 2 liters of indigenous cow milk every day, it is possible to save them, no matter how critical their condition is. It is possible for the patient to outlive the time given to them by the doctors. And if it is accompanied by proper Ayurvedic treatment, it leads to good results. I have seen many patients being told that they have only 15 days or 1 month of life left, but they have ended up living happily for several years. This approach is diametrically opposite to what modern medicine focuses on, which is the destruction of cells principle. Our focus is on building immune strength, and drinking indigenous cow milk can definitely help this bid. A normal person should drink this milk to prevent cancer. And a cancer patient should drink it to recover from the disease. Patient should drink